Hi, everyone. Thanks for your patience. I am Erin Heath. I'm Director of Federal Relations here at AAAS, and I have the great pleasure of interviewing Dr. Monica Bertagnolli. She served as the 17th Director of the National Institutes of Health. So we have just about 10 minutes, so I'm going to jump right in.
Great.
First, can you reflect on your time as NIH Director? And this is a three-parter. I'd love to hear what makes you feel the proudest. I'd love to hear what was the most challenging aspect and what surprised you the most.
So, first of all, unequivocally, my time at the NIH was incredible. It was the highlight of my entire career. And it's very simple. I have never, in my entire career, been in a place like NIH where every single person there has really one goal in mind and talks about that goal every single day, which is we want to support the biomedical research community and we want to make the world better for everyone. And we want everyone to live long and healthy lives. That is our ultimate goal. And I mean, literally, I worked in hospitals. I worked in, you know why you're there when you're a physician or a clinician or working in a hospital. But at NIH, it really was mission was top of their mind every single day. And it was just such an absolute joy to work with the people there with that kind of spirit and attitude, because the people matched the mission, in my opinion, and the people were there because of the mission. So it was amazing. Okay, what am I most proud of? People think of NIH as 27 institutes and centers that are all their silos. Particular people think, well, I'm interested in blindness. I'm interested in macular degeneration. I'm interested in diseases, vision diseases of the newborn. So you're going to go work with the National Eye Institute. Well, okay, but I can tell you the National Eye Institute works with the National Library of Medicine very closely, does amazing machine learning approaches to vision and analysis and imaging with the National Institute of Biomedical Imaging and Bioengineering, does amazing work with the person in the director's office who's responsible for coordinating data science, and does work, believe it or not, with the people in the National Cancer Institute who think about angiogenesis and how new drugs that we use to treat cancer can treat eye disease. What I'm trying to tell you is that it is not a collection of silos in any way. It's a team that thinks about what they're trying to do in health science and also views the entirety of NIH as this is our team to try to tackle this. For that, one of the things that was most exciting to me, I'll just do there, as director, because the director, what's the director's job? Director's job, make it possible for all these brilliant people to do their work. End of story. That's what the director does. So coordinate, remove barriers, discuss with Congress what are the important initiatives that we need our legislators to support. So for me, the best job about being director were two things. First of all, every single week, 2 solid hours with all the directors, just sitting down, solving problems. What are you worried about? What's most important? How can we solve? What do we need to do together? That was the highlight of my whole week. But then every year, we had a retreat for two full days. But this retreat was, everyone worked on it. Everyone, meaning all the directors and their staff, worked on it for a full 6 months. Before the retreat, we all picked 4 major issues that we wanted to all work on together to move everything forward. And then during those 2 days, we had to hear from everyone, a deep dive into the issues and what we were specifically going to do and how we were going to deliver. And then over the next coming months, we delivered. So again, I'm trying to emphasize that this is just an amazing team that really works together, thinks very broadly, better harness data the entire ecosystem of data across all of NIH and across everyone doing NIH research. What is the focus of the NIH intramural programs, and how do they make sure they augment, never reproduce, never displace, that they are using funding, special funding that they get in ways that the extramural community cannot achieve, being the added value? And what were those ways to stay key to that mission? How do we best think about the next generation and our supports for young researchers, new researchers, people who are new to the field, was another really important step. And then finally, how can we create a clinical research initiative that truly reaches all the communities we need to reach to eliminate our disparities in health across the nation? Those are the 4 things that we worked on. So I'm thrilled to give you a little insight into how we work.
Thank you so much. All right, so there's clearly been a whirlwind of news related to NIH that spurred concern in the biomedical research community, including, just to name an example, major cuts to facilities and administrative research support. What do you make of all this?
Well, in a word, it's devastating. It's devastating. I witnessed firsthand just how dedicated everyone. Well, let's start first. Let's start first with the extramural community. I mean, the extramural community, the people, 85%, who receive 85% of the NIH funding that goes directly to the extramural community across the whole nation, are the engine of biomedical research progress, frankly, for the world. And those funds, I can also attest, having been an NIH researcher for many decades, in every place those funds land, they are amplified. You know, a dollar spent from NIH to fund a research project also allows an institution to build infrastructure that can be used for other work that gets funded in other ways, so the infrastructure is critical, but also allows other research teams to have an educated, committed, ready workforce, and also expertise that can then be applied to so many other projects. So point is, vastly amplified funding comes from NIH research. Lastly, I mean, you know, everybody knows this. After you get your first NIH grant and you're funded, so many other things come your way that support you. So to lose that mechanism of implementation, like pure return on investment for the dollars that we pay in our taxes, that we support, I think is just a tragic loss. Then we'll talk about the people, which I think is just a tragic loss. Then we'll talk about the people. Okay, we got the very, very difficult news that 1,500, I think they're still working on the final number of people. Those fabulous people I worked with at NIH no longer have a job. Not only were they amazing people who were there to serve you and serve the entire community, they also included leaders for, and this to me is a crushing loss. Anyone who had been at NIH for many years, was an outstanding leader, and was promoted in the last year has also been fired, laid off. Because a promotion was considered giving you a new job, so anybody in a new job was probationary, and that's where they made the cut. I am devastated over personally, over the people that I know were elevated to positions based on their merit and exceptional service that are now out. So it's devastating, and this is a very, very difficult time for all of us. That's all I can say.
Thank you. I appreciate your comments. So there are a lot of new members of Congress this year, there as well as folks who are new to the administration. What do you want them to know about NIH or the biomedical research enterprise in general?
Well, let me just say that one of the other things that I really loved, frankly, about my job as NIH Director was the wonderful support I received from Congress. I mean, I never walked into an office where I didn't, and this was a very, very common occurrence, when I wasn't welcomed, when I didn't have great conversations with our legislators about what was important for us to do in health, when they didn't have good ideas, I didn't have good ideas, and it was really very, very bipartisan. Different legislators about what was important for us to do in health, when they didn't have good ideas, I didn't have good ideas, and it was really very, very bipartisan. Different ideas and approaches on either side, but both very constructive and almost entirely positive. And so I want to say that the experience of working with our legislators was very positive for me. I would just hope that anyone new to Congress would pick up that same thread and look at what we offer.
This is a pretty major cross-section of the community. What message do you want to share with them today?
Well, let me start. We need you so much. We need you all so much, number one. Number two, I know how hard it is to do what you do. I know how hard the education process is. I know how hard it is to get your first job, no matter who you are. I know how hard it is to get support when you have an innovative, all of your own idea, which is what we want to see and preserve. And you are so important and so valued and deserve and need to be supported for your contributions. I work in health, but guess what? Every single aspect of the scientific endeavor has an application in health. I mean, we all understand that very clearly. So we will not have a nation living long and healthy lives without every brilliant mind from all of the different fields of science contributing. Then, you know, a response though to the times we're in right now. The dust is going to settle. The dust is going to settle. Things are, you know, things are very in a state of disruption right now. But I have absolute belief that the value of science will not go away. It might be, it feels like it's not recognized as much, or it feels like it might be a little bit challenged from directions right now, but that will be very transient. Why? You know, things are very in a state of disruption right now. But I have absolute belief that the value of science will not go away. It might be, it feels like it's not recognized as much, or it feels like it might be a little bit challenged from directions right now, but that will be very transient. Why? Because we deliver. We deliver. And the last, science is magic that works. And it really is. It's about taking a problem that seems insoluble and just keeping at it until you see success. Even if it's a small corner, sometimes that really cracks us through to something that is transformative, and that's reaffirm our dedication to science being the magic that really works for when people need us.